Welcome to Conversations with Melissa, part of RenaFi's Experts and Influencer series. RenaFi provides practical, research-based advice, courses, and peer support, and focuses on the underlying drivers of our ADHD behavior. Through courses like budgeting for the ADHDer, home organizing for the ADHD lifestyle, and of course, our ADHD book club, to name just a few, we provide a holistic program that serves to help you thrive with ADHD, not in spite of it. Follow our YouTube channel for ADHD resources and information, and visit us at renafi.com to learn what we have to offer. Thank you so much to our guests here, Dr. Bill Dodson and Beth Bardeen. So today we're going to do RSD from two perspectives. We have Dr. William Dodson, the clinician, what RSD looks like from the outside in. Dr. Dodson is a board-certified adult psychiatrist who does not have ADHD. He has worked with his adult ADHD patients for the last 25 years to understand and document rejection sensitivity dysphoria. Dr. Dodson has been on the forefront of diagnostic and treatment reform for ADHD and rejection sensitivity dysphoria. He is now retired from clinical practice and resides in Colorado. Beth Bardeen, the RSD survivor, what RSD feels like from the inside out. Beth is an adult diagnosed with ADHD after a 30-year career in the Seattle tech industry, specializing in marketing and organizational behavior. Now Beth researches rejection sensitivity dysphoria and is an advocate for the newly diagnosed, with a focus on explaining the internal experience of RSD. She lives in Seattle and is the founder of the Seattle chapter of CHADD. All right, thank you both for being here. And
Melissa, thank you.
I'm just going to step out of the way. I'm going to take the focus off me and let you have at it and interrupt you every so often.
Sure. And thank you, Rick and RenaFi too. This is, we love this opportunity, really appreciate it.
Yeah, we covered most of the questions. A lot of the other things are around medication, so I'm going to step out.
Okay, so why don't we skip through this one, because we have beaten to death about the fact that it's not a mood disorder. And we've beaten this one to death, so let's keep moving so we have time for questions. The medications. Okie dokie. We discovered that two old blood pressure medications, guanfacine and clonidine, helped a great deal with RSD, and we discovered it totally by accident. These two medications are FDA approved for the use for the treatment of ADHD in children, for basically all the things that stimulants don't touch. The stimulants do one thing spectacularly well, and that is, once you're already engaged, it keeps you from being distracted. We also now know, thanks to Fred Reimer, that it can help a great deal with the loss of control of emotions. Can be almost curative of that. But there are an awful lot of things about ADHD that don't respond to stimulants. So the 5 questions I ask are: look back over your entire life. Can you remember a period of time longer than about 5 minutes and not drug-induced back in your wild and woolly youth, in which you have been both mentally and physically at peace? Most people with ADHD are constantly going. Their brain never shuts down. The second question is, since at least adolescence, have you taken at least 2 hours or more to fall asleep at night because you can't turn your brain and body off to go to sleep? About 75% of people with ADHD will endorse that. How many simultaneous lines of thought do you have going at the same time, even when you're on a stimulant? So we're not talking about jumping from thought to thought. We're talking about completely simultaneous lines of thought. Most people with ADHD, even on medication, will say at least 3. So it's like having three people talking to you at once. And then, of course, the definition of rejection sensitivity dysphoria. The alpha agonists have the ability to really manage all of these things that the stimulants don't touch. What people describe is for the first time in their life, they can sit and watch a TV show. They don't have to get up and walk around in a movie. They can fall asleep at night because their brain it doesn't replay every embarrassing moment of their lives in Technicolor. These are really wonderful medications. There are blood pressure medications, so that's about the only thing you have to worry about is for that older adult who is already on a blood pressure medication that you need to really work well with your primary care doc or cardiologist to make that transition from one to the other. The alpha agonist, every time you change the dose, it takes 5 days to see the increase in benefits. These are not drugs like Vyvanse or something like that, where you take the medication and an hour later you see everything it's ever going to do. With the alpha agonist, it takes 5 days. And if you're treating it up carefully, you only change the dose every 5th day. So it takes 2 weeks to get up to what is the most common dosage of 3 tablets of clonidine, which is 0.3 of a milligram, or 3 tablets of guanfacine, which is 3 milligrams. If you take the 60% of people who respond robustly, 80% of that 60% will find these 2 doses to be their optimal dose. But that also means that 20% of people who are robust responders will do so either below that dose or above that dose. Can you move the slide forward? Okay, we just did that one. Side effects. Anything that's going to really sort of turn down the volume on the adrenaline system has the potential of causing drowsiness. And these medications do cause mild drowsiness in about 1 in 4 people. I've had only one person who was not able to get up and go to work or school the next day. So, especially since you're starting at the lowest dose made. People get used to the mild sedation very quickly, usually by the time I increase the dose 5 days later. Dry mouth is a very common side effect. It takes a couple of months to get rid of. And the place where it really becomes difficult is that one of the most common side effects of the stimulants is dry mouth. So if you're taking 2 medications that make your mouth dry, it can be a real problem. Now, water bottles are not a substitute. We need saliva because it contains all of the antibodies that prevent heat decay. So you can use these xylitol melts, what they're called Zymelts or something like that, or you can talk to your doctor about a drug called Salogen, which is used for Sjogren's syndrome. But since there are about 1,800 medications that cause dry mouth, your doctor will have a lot of tricks up his sleeve about doing something about it. The mild headache will odd when somebody's having a dry mouth and drinking a lot, but you still need to push hydration. But really the thing that helps the most is just take 1 aspirin and 1 ibuprofen. These are usually what are referred to as 1 aspirin headaches. And then the last one, and we come up with these awful names, orthostatic hypotension. This is something that every one of us has had the experience with standing up quickly and without warning, and we get kind of a head rush, vision goes dark, we get dizzy, and that's because blood is pooling in our feet. This can happen more frequently with alpha agonists until you get used to the medications in about a month. So here's a little tip. If it's happening to you, curl your toes tightly in your shoes and it won't happen. Next.
We have a couple questions around the things that you're talking about right now. One is the medication for dry mouth. Could you say it again and maybe spell it?
SAL. Allergen.
S-A-L-S-L-A-G-E-N.
Lagen. Yes, it works very well. It cannot be given to people with uncontrolled asthma. It'll make their asthma much worse. But your doc will know that.
Does your doctor know that? Excellent.
Yeah.
Thank you for answering that one. There's someone with a drug interactions question, especially for people with mood, anxiety, and ADHD. What if you're taking things for more than one condition?
As people with ADHD usually are. 70% of people with an ADHD diagnosis will have at least one other diagnosis. 57% will have two or more. This happens all the time. The stimulants make my life very easy. They don't interact with any medications at all. They're very good, very safe, don't have any cardiac complications. They're just great. With the alpha agonists, again, the only real problem you're going to have is for that older adult who is already on a high blood pressure medication or who is already having orthostatic hypotension. The person, for instance, who has POTS syndrome, paroxysmal orthostatic tachycardic syndrome. You know who you are.
Can we go back one step? You had said to curl the toes, but I missed
When you
what you had
stand up.
said right ahead of it. Why was I curling my toes?
Oh, if you have that, when you stand up suddenly and get a head rush and dizzy and vision goes a little gray and stuff like that, you can prevent that from happening if you have the presence of mind. Curl your toes tightly in your shoes before you stand up.
Oh,
We don't want you fainting.
so
Fainting
helpful.
very rarely.
Hey, Dr. Dodson, we've we've talked about this. My prescription was always one milligram of guanfacine 3 times a day. And you had said or suggested take them at bedtime because I was having that lightheaded feeling. I started taking them at bedtime a year ago. That went away. Now with new insurance, they will only give me a 3 milligram pill to be taken once a day at bedtime. Works the same as the 3. Is that, why is it in the PDR to prescribe it at 1 milligram 3 times a day? Is that a common prescription? Is that how it ends up that way?
That's how the FDA works.
Okay.
FDA moves in mysterious ways. Imagine that you run a pharmaceutical company and you have spent $2 billion, that's billion with a B, getting your new drug ready for its last hurdle, which is called a stage 3 study. How are you going to design that study? You're going to make sure that the dose is low enough that you're not going to have any chance at all of having a side effect that would keep your drug from going to market. And you have to prove that it actually works for what you say it works for. So just about every drug that's in the physician's best reference is dosed as low as it possibly can to ensure that you get the effect but no side effect. I have many people who are on 7 or 8 milligrams of guanfacine or something like that and doing just fine. Again, there's that old saying: if you know one person with ADHD, you know one person with ADHD. People with ADHD are really different, and so when you're fine tuning the medication, it wants to be to that unique individual who's there working with you. Nobody buys off the shelf.